I'm Melissa Ponzio, and this is WebMD's Ask the Pharmacist. With McCary Weck-Marciniak, National Spokesperson for the American Pharmacists Association, Clinical Associate Professor at the UNC Eshelman School of Pharmacy, and practicing pharmacist. She's here to answer the most frequently asked pharmaceutical questions put to us by you, the WebMD community. Today, we're talking about common drug questions with a focus on financial concerns, expiration dates, and when to treat yourself over the counter and when to see a doctor. And let's get started with a few questions from our budget-conscious viewers. What can I do if the generic doesn't work the same for me as a name brand? My insurance company wants me to use the generic.
Generic medications are just as effective as their brand name counterparts. In fact, they've been tested by the FDA to be sure that they're just as effective. But they differ in that they may have certain different colors or fillers as a part of that tablet. And usually, generic medications are just as effective but less costly. So insurance companies and pharmacists do try to recommend generics when possible because they can work just as well for people but generally cost a lot less. Now, I first would want to ask this person a few more questions to figure out why exactly they think this medication may not be working as well.
Right.
Is it that their pain doesn't feel like it's as well relieved? If it's a medication for blood pressure, have they noticed that their blood pressure readings are a little bit higher? So I might want to ask a few more questions. And if we had some good information that we could go back and talk with their primary care provider about, if we really did feel like this medication was not working, there may be alternative generic medications that we could use, or maybe putting them back on the brand name product they may have been on previously.
My husband was laid off and we can't afford his medications. What can we do?
As the economy has been difficult, some people have been losing their jobs and their health care insurance coverage, and they are turning to pharmacists to help them out with these questions. So I think this is a wonderful opportunity for our pharmacists to work with the patient to help them find the medications that will work well for them, but that they can afford. So I would encourage this person to go talk to their pharmacist. Pharmacists now have the ability to sit down and talk with you about all of your medications, and you can schedule what we call a medication therapy management appointment. And that's a one-on-one appointment for you to come in and bring in all the prescription medications you're taking, all the over-the-counter medicines or herbal products and dietary supplements, and I can review them with you and see which ones are working for you, and maybe where possible in this case, which could be more less costly for you, but still work just as well. So I would encourage this person to go and schedule an appointment for a medication therapy management visit. And for many people, this is a covered part of their health care insurance coverage. But if it's not, you still may be able to do it at a very low, reduced cost with your pharmacist. And that might be a good place to start with. And then based on what we find there, we could talk with that person's primary care provider to see if there's some things that we could change so that they could still keep their medications treated, because certainly we don't want people to be cutting costs and making difficult choices with their health care. We want to keep them as healthy as we can, even considering that the medication, the money may be not there to support their medications as they used to take them.
How can I save money on my prescriptions?
Well, again, cost is a big issue for people today, and we're always looking for ways that we can save money. Definitely one of those things to look at might be whether or not there's a generic available for a prescription that you might be taking, or looking at the pharmacy to see if they have a prescription discount program that you might be able to be a part of. Or a lot of pharmacies also price match, so maybe they're able to match the price you might be getting at a competitor. But I think one of the good things is for a patient to always use the same pharmacy to fill all of their prescriptions, and that way you're developing a relationship with that pharmacy and that pharmacist, and they're going to be looking out for you in your best interest and recommending those types of cost savings alternatives when they're available. But really, the most expensive medication is one that's not taken appropriately. And so as a pharmacist, I always try talking with my patients to ensure that they know exactly how to take their prescription medications and are using it exactly as prescribed. And that way, they're going to save money in the long run because they won't be going to the doctor's office for unneeded visits or maybe to the hospital or the emergency room. So in that way, we can keep medication costs down by keeping you safe and healthy and using them as prescribed.
My mother passed away and I found some of her old medications while cleaning out her house. I've heard that it's not good to flush medications down the toilet anymore. So what are you supposed to do?
Medication disposal is very important for people to know how to take care of the medications that they have appropriately. And you may have seen some press about this very recently. In the last few years, groups like the American Pharmacists Association have put out guidelines and instructions about how to take care of your medications appropriately. So the current rules are not to flush these medications down the toilet. So what you'd want to do is find a disposable bag that you may have at home, something that will seal.
Okay.
You'll place those medications, either pour them in if they're liquid or crush them up if they're a tablet, and put them into that sealable bag. and then mix in some coffee grounds.
Okay.
Put those with the prescriptions and then seal that bag up. And then you'll put that into the trash can. And that way it protects those medications from getting out into our water supply or into the environment where they could be harmful. And so that's the best way to dispose of your medications if you're at home. Another new thing, though, that's coming up is that a lot of pharmacies are hosting medication take-back programs. And so you might want to check with your local pharmacy or in your community. And this is one day usually of a year where you can come to the pharmacy and bring in some of those old medications you may have around, and the pharmacy will dispose of them in a safe and effective manner. So check into that because you may find those happening more often in your local community.
My eye drops say they expired last month, but it should still be okay for me to use them, right?
Well, as a general rule, I usually tell my patients to not use products past their expiration date. And I know that's very tough to hear. Sometimes people want to eke another month or two out.
Right.
But I think it's safest to stop using those medications when they're past their expiration date. And particularly for something like an eye drop, I would be hesitant about using something like that past its expiration date. Not only may it not be as effective for you, but it could be unsafe. It's very possible that that eye drop may have gotten contaminated, and you could be actually putting a product into your eye that could cause more harm than good. So I would encourage someone to not use a product past its expiration date.
How do you tell if you have a cold or the flu? I want to pick up some medication for my husband, but I don't know which he has.
This is a great question to ask a pharmacist. Cough and cold is a common ailment that we get asked a lot about in the pharmacy setting. So for a cold, colds usually have a very slow onset. Usually it'll start with having some sore throat that kind of progresses to some stuffiness or a runny nose, some sneezing, and then eventually a cough. And it usually lasts for about 7 to 10 days. A flu has a more sudden onset. I hear some people say they feel like they got hit by a train, where it comes on very quickly, and they'll usually have a lot of aches and pains and some fever. So they are very different, though people use those terms cold and flu interchangeably. So when trying to figure out what to use, you need to think about your symptoms and talk with your pharmacist so that they're clear on the symptoms that this person is having. And basically, as a pharmacist, we try to match up the symptoms that you're having with active ingredients we know will treat that symptom. So for example, if you're having aches and pains from the flu, then we can recommend an over-the-counter pain reliever. If maybe you're having some of that runny nose or sneezing, then an antihistamine might be the best choice for you. Or if you're congested, then we might recommend a decongestant. So there's lots of different options available. But before we can eventually recommend a product, we also will need to know what chronic conditions that patient may have or any medications that they're taking. Because for some things, there may be some choices that would be better than others or some things that could interact depending on what else they're taking.
My doctor wants me to take Prilosec for reflux and gave me a prescription. Can I just buy it over the counter?
We do see an increasing trend of medications that were once available by prescription now being available over the counter, and Prilosec is just one of those options. So it is something that she may be able to take over the counter. Prilosec, though, is still available as a generic prescription medication. So I would want to talk with this patient a little bit more to find out about their insurance coverage, because the insurance company, if they're using one, may be able to give them that medication as a prescription at a less cost than the over-the-counter product. But maybe the over-the-counter product is a lot less expensive, especially if they don't have healthcare insurance. And so I might need to ask a few more questions first to figure out if it's the right choice for them. But certainly now we do have a number of over-the-counter medications available to you that were once only by prescription.
Okay, let's take another question. How long is it safe to take over-the-counter insomnia medications?
And we should only be treating insomnia over the counter for about 2 weeks or so.
Oh, okay.
And we find so many people who take insomnia medications much more often than that. So really, insomnia medications should be used sporadically, as needed, to help you get to sleep. And usually that should only be in the short term. If you're finding that you need to use an over-the-counter medication to treat your insomnia and you're doing it more consistently, and particularly something beyond 2 weeks, then we really need to have you go talk to your primary care provider, because it's very possible there's something else going on, or maybe that you could use a prescription medication more so than an over-the-counter medication. So really, you shouldn't be treating insomnia for any more than 2 weeks.
Okay. My 3-year-old daughter hates the taste of her medicine. I heard that you can get them flavored. Is that true?
Absolutely. And this is definitely a trick that I think a lot of parents are interested in finding out more about, and some who probably have and have had good success with it. So many community pharmacies have this available, and you can walk into your community pharmacy and bring in a prescription, either a prescription product or even an over-the-counter product. And based on the ingredients in that product, we can look it up to see which flavorings might be the best for that active ingredient, which will cover them up the best or mask that unsightly kind of taste that some of those products do have. And you might have some good options. There's probably about 40 flavors that are available available. And so you can probably find a good flavor to cover up the taste of that medicine and be something that your child will really enjoy.
Or I might really enjoy.
Absolutely. It works for adults just as well as it works for children. Good. So that's definitely something I would look into. And there may be a nominal fee for adding that to a product. But in the end, if it's going to encourage you to take that medication more often, I think a lot of people are interested in doing that.
Absolutely. I have difficulty swallowing pills. Help. What can I do?
You are not alone. In fact, I also don't like swallowing pills, and if I can avoid it, I will. And the good thing is we have so many dosage forms available to us today. So depending on what you're taking, there may be dissolvable tablets that you could use. A good example of this over the counter might be like a loratadine. Brand name might be Claritin or Alavert. We have some that are available in swallowable tablets and some that are dissolvable. And so in that way, you can avoid having to swallow a tablet. You can just put it on your tongue and let it dissolve itself. We have a lot of products that are available as liquids, even gummies, or lots of different forms. So really, we can help find the one that works best for you, that's the most palatable, so you can take that medication.
Is it just grapefruit juice, or are there other things you shouldn't eat or drink if taking statins?
Grapefruit juice is definitely a tricky area, and it's one that we get a lot of questions about as well. So grapefruit juice or grapefruit can interact with a number of medications, and statins are just one example. Some other high blood pressure medications might be another one people commonly think about. Now, the data on this is varied, and I have some good resources that a lot of pharmacists know and can access to help them figure this out. But more often than not, the data is conflicting for each product. Sometimes it is something that could affect the absorption of that medication, and sometimes that may not be so clinically important, where it really will make a difference in how that medication works. So generally, as a rule, we try to avoid patients drinking grapefruit juice or eating grapefruits while taking medications like statins. It's best to just sort of avoid it altogether so we know there's not a problem. If you're someone who really can't give up that grapefruit juice, maybe a good idea would be to do it consistently so that you're always doing that and using it at the same time. And especially if it's a medication like a statin, we're going to be doing some laboratory monitoring to make sure that that product is working okay for you. And that's really what your primary care provider and your pharmacist can help you do. But really for statins, those are the only problems with interacting with grapefruit or other drugs or foods. But the other thing to think about when taking statins is they're primarily for cholesterol. And so you should be following a low-fat, low-cholesterol diet.
What should I look for in an acne treatment for my son? There are so many choices.
Acne is a very common ailment, especially in teenagers and adolescents. And there would be definitely a couple of questions I would want to ask this mom first. And it may get to sort of questions about the location of the acne and its severity. So if it's present on the face, or is it also on the arms or the upper body or the back? Certainly acne can be present in a lot of different places. And how severe is it? It'd be best if I could look at that individual themselves, but maybe the mother might be able to describe it well enough to me so I can see if it's sort of more mild or maybe more severe. So if it's something that's mild and maybe limited to the face, a great place to start is benzoyl peroxide. It's available in a lot of different forms over the counter, primarily in creams, and it ranges from 2.5% to 10%. So I would start with a benzoyl peroxide 2.5% and cream and apply that once to twice daily and see how that works. Now, if it's more widespread and all over the body, well, there are things that we can get prescription as well. And your doctor may recommend things like a prescription antibiotic to be able to treat that acne. And if it's more severe, then we would probably definitely go a prescription route. So there's a lot of things to think about with the acne, and I would want to know more about the location of those acne pimples and also how severe it is to determine if over-the-counter treatment is appropriate or if they need to see a doctor to get some prescription medications.
Okay. I forgot to take my birth control pill. Do I double up or skip it? Will I get pregnant now because I messed up?
This is very important for women to know and understand. So when you miss a dose of an oral contraceptive, there could be the chance you could become pregnant, but it just depends on when you've taken that dose, and you need to make sure that you follow the right instructions for taking that dose again. So every oral contraceptive comes with instructions that talk about what to do in the event of a missed dose. And it varies whether or not you missed your dose in the first week, the second week, or the third week of your cycle. And so the instructions may vary depending on when it is. And so always follow the instructions that come with your particular product to be sure you're doing the right thing. So in the event that you missed a dose, the important thing is to remember that right away and to go ahead and find those instructions. And if you have any questions, call the pharmacy and the pharmacist can walk you through that. But generally you want to make sure that you get right back on track, and it may be recommended that you use a backup method of contraception for about a week or so. And that may be something like a condom, so that you are just ensured that if you have any unprotected sex, that you won't have the chance of becoming pregnant if that's not in your plans.
Okay. Is there an over-the-counter diet pill that works?
Well, we are fortunate now to have a prescription product that was once prescription, now available over the counter. That's Ally. The generic name is Orlistat. It was once available only by prescription, but is now over the counter. And this is actually the only FDA product that's approved to treat weight loss. And it's to be used in conjunction with diet and exercise, and in a way for you to help you lose a little bit more weight. So in fact, the studies show that when you take Ally, you can lose 50% more weight than if you were just doing diet and exercise alone.
Okay.
So that can be very helpful for some people. This product is available as a tablet, and you take one tablet with each meal, so breakfast, lunch, and dinner. Now, some of the side effects that could happen is you might notice a little bit of diarrhea, and that's possible when you don't eat, especially a low-fat diet. So if you watch the amount of fat that you're eating in your diet, you'll have less of those problems occurring. And another side effect that has been rarely reported is liver injury, and so you will see that on the label. So I would just make sure that you talk with your doctor, your pharmacist first, to make sure that they think this is an appropriate choice for you to combine with your diet and exercise in order to lose a little bit more weight.
My son is taking Augmentin. Can he go in the sun?
There are some antibiotics that people can have a photosensitivity reaction to if they're out in the sun. And this means that when they go outside, they'll have a bit of a rash that's displayed. And it's something that's very problematic. But Augmentin is not one of those antibiotics that can cause that problem. So in general, I would encourage a mother going out with her son to make sure that this child is wearing sunscreen or maybe using a hat, because we do want to protect them from being out in the sun anyways. But in and of itself, the Augmentin won't be a problem with being out in the sun.